I just want to talk a little bit about kind of how you came to the decision of IM. It seemed like you knew pretty early on, actually, unless I'm mistaken, that you want to do IM and still playing on HEMONC or
Yeah, still
yeah.
thinking hemonc. And last year it was funny because in May, my very last rotation of third year, I did my second general surgery month, and my
Mm,
first one was in December. And the preceptor I worked with didn't really inspire me to like explore the field seriously. But when I
okay.
did it in May, the surgeon and I got along really well. He was a good mentor, and he kind of threw me for a loop, and I ended up doing like a sub-IN surgery.
Oh, dang.
Almost, I
Yeah.
liked, I liked the lifestyle,
Hmm.
like the lifestyle of IM a little bit more as far as like family oriented, hours and all that, and also
Yeah.
just being able to transition my career a little bit towards, I guess, more, potentially being like a chief medical officer of a startup and working in the field still without like having a lot of clinical duties as my career like was on its second half.
Mm. Okay, so yeah, I just put up I guess an interview with another IM student who also had that similar thing where him and actually I actually had the same experience where we had good experiences with surgery. Seemed like you did too, and then we almost went into surgery, but then the lifestyle just didn't work out, unfortunately.
Yep.
And then yeah, it seems like you also want to do more of like that CMO type deal, or maybe a consultant or something like that for a startup, or I don't know. That seems to be the new wave, maybe.
Yeah.
So what drew you to IM in particular, like, and HEMONC exactly? Was there like a
I
certain thing
think
that set you off, or was that just kind of like you thought it was like I feel like it's the heart of medicine. So is that you just went into that kind of you know naturally, or how did that play out?
I think before med school even started, the experiences I'd had as a scribe and then through AmeriCorps working at a clinic that was an internal medicine clinic for patients mainly over 60
Hmm.
inspired me because I saw that IM presented the opportunity just to really critically think about what's going on with the patient and work them up diagnostically. I
Hmm.
liked that you had a little bit of time to just think through some problems and just really like absorb a case without like, jumping into action right away, like in surgery. You kind of have it as you need to and see a patient's care through. And then with HEMONC specifically, as far as all the patient populations I've worked with, I think they're probably the most motivated patient population I've seen, and
Hmm.
they're the most likely to adhere to their medication regimens and keep their appointments. Which, as a physician, I think that is very rewarding to see the patients giving as much effort to their care as you are for them. So
Hmm. Yeah, that's one of the reasons why I was thinking of doing sports med, just because the population tends to be very motivated, especially working with athletes. They want to get sometimes they're maybe too motivated. They're just like, trying to get in before
yeah,
they even follow your recommendations, right? And they're pushing
right.
past things and stuff. So having that like kind of a joint effort where like the patient's on your side trying to work with you instead of like a lot of primary care, unfortunately, the patient doesn't necessarily want to work through their or the best, like, treatment measures. They're trying to get, like, a pill to fix something and then just leave or address whatever's, like, painful or whatever.
Mhm.
Um, it's one of the, like, the main reasons I wanna do sports med, but I don't know, I feel like there's still some some aspects of just general practice too that still appeal to me in some regards. I feel like I'd want some of my clinic to be maybe general practice, but, it is, like you said, I think super rewarding to work with, like, highly motivated patient populations that are willing to work with you.
Mhm.
Why not family med?
Well, I guess less opportunities to specialize was the biggest thing, and
Yeah.
since oncology has been on my mind for a while, I feel like I could pursue the same avenues as a family physician, like if I wanted to be a generalist,
Mhm.
but have more avenues to go down the specialization route
Yeah.
with I.
Yeah, definitely.